Hello, everyone. Dr. Jennifer Teal here with a brief lecture on evaluation and management, or E&M services. For the outpatient setting or for the professional bill, so that's the services by the clinical staff versus the facility, right? You have an institutional bill, which is the hospital's bill, and you have professional bills on inpatients, that's for the providers. So your E&M services are some of the most widely used codes within the CPT book to capture those services. Most outpatients, especially in the primary care setting, are going to be using E&M codes, but there are also E&Ms on your inpatients for the evaluation and management of the inpatient at the bedside. So always with any of the sections of CPT, you're going to always read the section specific guidelines. And as you can see with the E&M services, we do have some guidelines here that you need to become familiar with. E&M codes are arranged by setting. So for example, office or other outpatient, hospital observation, hospital inpatient and observation care. And then we have consultations, emergency department services, critical care, nursing facilities, and so on. So make sure that you know what setting the event is taking place in, because that's going to be your first step, what setting, so that you know which range of codes you're going to be using. And then the E&M codes are determined by level of service provided, and also they might be subcategorized by new versus established patient, or initial versus a subsequent service. So become familiar with those. New versus established patient. The new patient is kind of the easy one. They've never been seen. But the established patient is one who has received professional services from that particular physician or other qualified healthcare professional, or another physician or qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice. And that definition is right here. So for the group practices, maybe normally you see Dr. A and Dr. A is out on vacation, and so Dr. B is filling in. Although you've never seen Dr. B, you've seen Dr. A within the last 3 years. So technically speaking, you are an established patient for that practice. So they have your record, they have all of your information. It's the same group practice, it's the same specialty. You would therefore be an established patient. And there's a decision tree that's going to help you make that determination of new versus established patient. And then some are the initial versus subsequent. So like an inpatient, for example, the initial service is when they're first admitted. And then subsequent service would be every event that occurs after that initial admission. So the doctor comes back daily, maybe, to evaluate the patient. Those would be the subsequent services. So that's kind of the subcategories within the E&M codes. And then the next biggest thing is how to figure out what the level of E&M service is, because all of these categories and subcategories are then going to have maybe 3 to 5 code options depending on the level of service provided. So this section right here is the key to figuring out that piece. So the level of service is either based on the level of medical decision-making, or MDM, or it's going to be total time. And when we're talking about total time, we're talking about the total time for E&M services performed on the date of the encounter. So let me zoom in a little bit so you can see that. The level of medical decision-making as defined for each service, or the total time for E&M services performed on the date of the encounter. So you would add up the time spent that day. Time must be documented. In order to use time, they must indicate the total amount of time they spent. Otherwise, you're going to be using the medical decision-making criteria. For medical decision-making, there are some criteria here where you figure out, is it straightforward medical decision-making? Is it moderate decision-making, etc.? So this grid here is what helps you determine the level of medical decision-making. And you might be wondering, well, how do I make sense of this table? And what are all these columns and what does that mean? Level of medical decision making is based on 2 out of 3 elements of medical decision making. So here are your elements, these columns here. So the number and complexity of problems, the amount and or complexity of the data, and the risk of complications and or morbidity or mortality. So 2 out of 3, when we say 2 out of 3, what we mean by that is, let's say you had minimal here, and you had moderate down here. Even though moderate is higher, 2 out of 3 have to meet or exceed that same level. So since we have 2 up here, we would end up in straightforward. Now, likewise, if we had moderate and moderate, but a low risk, because 2 out of the 3 are in this row, then we're able to code it to a moderate level of medical decision making. So 2 out of 3. Now, if you have a scenario where you're you only have 1, 1, and 1, then because it has to be 2 out of 3, you're going to end up at your lowest level. Because you have only 1 here, you don't have 2 in this. Well, actually, let me rephrase that. Because you have 1 higher and 1 at this category, you'd end up right here. So I did that backwards. I apologize for that. So 2 out of 3, if you go 1, 1, 1, if I was to draw a line here, I've got 1 here and 1 here. So this moderate exceeds low. So even though I have limited, I have higher than low, but I don't have 2 up here. So I can say, okay, we're at low level of medical decision making based on the limited and moderate, because 2 out of 3 meet or exceed. So that's the key, meet or exceed. So even though I have minimal risk, I have limited amount of data and I have moderate complexity, then 2 out of the 3 meet or exceed this low. They don't meet or exceed moderate because I only had 1 there, but I had 1 here and 1 here, therefore I can go with low. And as you gain experience with this, it will start to make sense, but always the 2 out of 3 meet or exceed. Keep that in mind. 2 out of 3 must meet or exceed. And it's always easy when they're in the same category. Then it's kind of straightforward. But when you have elements that fall to different levels, that's when it becomes a little bit more tricky to make sure that you're in the right row, right? So the figuring out the level for the individual elements is what is kind of detailed here. So the number and complexity of problems addressed, minimal versus low versus moderate, it tells you that minimal means there's only 1 self-limited or minor problem. So the patient comes in for a single problem, which is a minor problem. Then your number and complexity of problems would be minimal. If they come in with 2 or more, or a stable chronic illness, so maybe they're here for a follow-up of their COPD, that would be 1 stable chronic illness that would qualify for low. Or. So there's all these ors, and you're just going to figure out which one applies to your scenario. And also, this does continue on the next page, so be aware of that, because there's also a high. See here, there's a high level. So it carries over on 2 pages, but we either have straightforward, low, moderate, or high. There are 4 different levels of medical decision making. So some of these, how to figure out these elements in the columns, some of that is described further once you get past the table. So first of all, number and complexity of problems starts before the tables, and then it's going to continue after the tables. So see, continued on page 10. So read the number and complexity of problems will help you figure out this particular column. And then let's go past the tables. So this is still a continuation of the number and complexity of problems. It describes what a problem is. If you can see that, let me focus in a bit. A problem is a disease, condition, illness, injury, symptom, sign, finding, complaint, or other matter addressed at the encounter, with or without a diagnosis being established at the time of the encounter. So it's telling you what the definition of a problem is. It's telling you what the definition of minimal problem versus self-limited or minor problem. So it's giving you the definitions here. Make sure that you refer to that. And then we have, similarly, we have information on the amount or the complexity of the data. Let me see if I can make this appear a little bit better. It looks like I have a little bit of a glare on there. So let me see if this helps at all. Okay, so this is, and I do apologize that the camera is not the best camera, but I really wanted to be able to demonstrate in the actual code book for you, because this is always available to you. This is what you're going to refer to as needed. So amount or complexity of the data, that goes back to this column right here, amount or complexity of the data. There we go. So this column is described right here, okay? And it tells you, what does it mean to analyze? What does a test mean? So that's the next one. What does a test mean? Tests are imaging, laboratory, psychometric, or physiologic data. Lab panel is a single test. So even though a lab panel might have several components to it, it counts as a single test. So these definitions and criteria are important. The other thing, next we have the risk of complications. And, what is a risk? What does morbidity mean? What is social determinants of health? What's a surgery? Minor or major surgery, elective or emergency surgery. So use these, and then you'll notice after that we get into the actual categories. Now for this piece, one thing that I want to make sure that you're aware of is before you actually get to the guidelines, there are these little tables right before the guidelines. And these are a very good, helpful snapshot, because if you know the setting, office or other outpatient services, we've got initial hospital inpatient or observation, and then notice new versus established. New or established, new or established. So this is initial, this is subsequent. And so what it's telling you is the code range. So you're going to either use 99202, 99203, 204, or 205. That will be the code that you assign for a new outpatient visit. And what you're going to do is figure out, okay, what is my level of medical decision making or time? So remember, we said total time could be a factor. If they've documented the time spent and they say that they spent 30 minutes, then you could use time as a factor and you would end up with 99203. Then we have the elements of the medical decision making. Was it a straightforward, low, moderate, or high? And how you figure that out, again, is back to the table. You have to first figure this part out to figure out each of those elements. And then you come here and say, okay, I have straightforward, therefore it's a 99202. Or I have moderate, therefore it's a 99204 for a new patient. For an established patient, and you have, there's no 99211 that's going to be applicable. It's 99212, 213, 214, 215. And then we have our level of medical decision making. Did we determine that it was straightforward, low, moderate, or high? So moderate is going to end up in a 99214, whereas over here it was a 99204 for new versus established. So this grid kind of helps you, but the full description is always with the code itself. So if we go over here, we'll see that the very first category is our office or outpatient. And this is where we see the new patient, 99202, the evaluation and management of a new patient, which requires a medically appropriate history and exam. And medically appropriate is determined by the clinician. They determine what kind of history and physical is appropriate. And then what we need to figure out is the medical decision-making piece. So it says, and straightforward medical decision-making. When using total time, on the date of the encounter for the code selection, 15 minutes must be met or exceeded. So 99202, new patient, here's your description for medical decision-making or time. And then next we have the 99203, office or outpatient visit. And this is going to be with a low level of medical decision-making or 30 minutes of time. So these are for the professional services versus the facility. And then again, so these are all the new, and then we get into established. And then we go to our next category, hospital outpatient services, hospital observation services, hospital inpatient services. And they all have these similar descriptions. So as I look here, this is the initial hospital inpatient or observation care per day for the evaluation and management of a patient, which requires a medically appropriate history and or exam and straightforward or low medical decision-making. So in this case, straightforward or low is going to render the same code, 99221. And this is for the initial hospital inpatient or observation. So that very first time. And that's during that admission. And then here's your subsequent. So this would be your initial, this would be your subsequent. So the initial has either 99221, 99222, or 99223. So we only have 3 code choices for this particular subcategory. So this one was the straightforward or low medical decision making. This one here is moderate level of medical decision making, and this one here is high level of medical decision making. So one thing that might help if you're using your paper code book all the time versus an electronic encoder is you might want to just come through here and then underline straightforward or low, so that stands out for you. Underline moderate level. Underline here high level, so that you can see which one's which and easily make the distinction between them. So this whole red section here is E&Ms. It's up front, even though these numbers are not sequential in terms of the rest of the book, because anesthesia starts with your zeros. So anesthesia is your zeros, and these are 9s. They put them up front because, again, E&M are the most widely used codes out of the code book. So that's why they're front and center right up front. So with anything coding, it's always important for you to read the guidelines. And with CPT, there's section guidelines. So at the beginning of every section, it gives you the outline of the section, and then it gives you the section specific guidelines if applicable. So I'm in the E&M category, I'm seeing the E&M guidelines. If I go to anesthesia, I get that same overview. And then right here, we've got some guidelines. And then we have the bigger anesthesia guidelines. In this case, we also have anesthesia modifiers. So always review the section guidelines when you're coding in CPT, very important. In E&M, this table is the one that you really need to understand. And again, it carries over onto the next page, but that level of medical decision-making is what determines the E&M code. So you have to really understand how to calculate the level of medical decision-making. So do some practicing to make sure that you thoroughly understand each of these elements. Make sure that you understand, you know, what the number and complexity of problems is, for example, what the level of risk is, all the definitions that I showed you that it gives you in the guidelines themselves. Okay, so with that, I'm going to go ahead and end this. I didn't want it to be too awful long, but I wanted to give you an overview of how you go about determining the level of E&M service. So I hope you found that helpful.